Hi everyone, welcome back. Today's topic is about how to ice or when to ice and how to heat or when to heat your injuries or conditions that you might have. So this is probably one of the most confusing things that patients oftentimes will come into my office and ask. So before we start, let's talk about the stages of healing. There are 3 stages of healing on any particular injuries that you might have, right? So the first stage is what we call the acute stage. Second stage is the subacute, write the spell here. And the third stage is your chronic stage. Okay. Now, typically, when we're talking about heat or ice, the acute stage is within one through 3 days. Okay. The subacute is from 4 days on to it can be as long as 3 months. And then the chronic is from 3 months on, okay? So those are basically the 3 stages of healing that your condition can undergo. And based upon those 3 stages, we're gonna help everybody to understand when and what particular time you should be either heating or icing or continue to ice or go back to icing after the pain has subsided. So let's kind of delve into it more on the why we should do it a certain way, and of course, what are the benefits to icing or heat based upon the condition that you might have. So let's first try to help you guys to more easily determine how to ice or heat your condition. So just say that you just injure your back, let's say, right, on Monday. So on Monday, so we're gonna use the chart here. So on Monday, here we're gonna do M for Monday. Your pain level has shoot all the way up or is up here somewhere, okay? So, of course, as soon as you have injured a particular joint, any joint, okay, as long as it is a joint, sometimes soft tissue, you of course put ice on it if you have a bruise, right? But typically, when you have an injury in the area of a joint, you have to put ice in it right away. So, of course, within the first 1 through 3 days, right? So 1 to 3 days, your pain level is a bit high. Now I'm just gonna draw the pain level might go like this or down here to your normal, no pain down here, right? So let's walk everybody through on why we should ice that. Of course, most people know that icing is to take down swelling, but you also don't realize that it also stops the tissue damage abruptly, okay? So most of the time it's not that critical when you have a particular muscle, okay? Now, if you have a muscle and you have been injured, as in with a blunt force, like somebody hit you or a ball or baseball hit you in the head, of course you want to put ice on it right away, not only to stop the swelling, but also to prevent the bruising effect that comes in there. Because what happens there, when you are injured, blood flows actually comes in there at a very, very high rate for healing. So as soon as that happens, if you don't have ice on it and pressure, what happens is that the swelling will increase, more tissue damage is gonna occur, and then pretty much the next day, you're gonna be having a 100% chance of having a big old lump right there, or definitely bruising at the least, okay? So pressure and of course icing in that area will take the blood flows away from the area temporarily, and that's gonna help you to limit the amount of swelling and limit the bruising and limit the tissue destruction or cell destruction in that particular area. Now, normally as the pain subsides into just say from 4 days on, just say to 6 or 7 days, right? Most of the time, people oftentimes will say, well, you know what, my pain is getting better. So they want to start applying heat as the pain comes downward because that's what everybody's told. So after 3 days, you need to start putting heat right through this area, okay? Now, let me throw something in there that, will help everybody to kind of visualize so you can know specifically if you should heat or ice, when it comes to an injury. Because again, it can get very confusing. Now, what I mean by that is that what if, just say, that within those 4 days or after the 3rd days and go into the 4th or 5th days, right, your pain level literally stays this high. should you keep the ice on it, or should you start heating it just because you're in the subacute stage, because you're after the 3 days where you shouldn't be icing it anymore? The easiest way to remember this is to visualize this chart right here. Think of this here as in when the pain level is highest, it's actually at the mountaintop, okay? And when the pain level is lower or dropping down here to the no pain level here, you're in the valley. Okay, actually I should need to do the valley in heat wise, okay? So here's your valley, that's gonna be hot and warm down here. The cold is gonna be up in the mountain range right here, okay? So here you have, it's cold right here. So, sorry there. And so as the pain starts to come down, you wanna start to put heat. Now, the only difference is that I always tell my patients, if you are continuously having an exacerbation in pain, okay, you don't want to keep putting heat on it. So just say that you injured your back, okay, again, go back to Monday. Now, on Friday, you've been doing pretty well, okay, your pain level starts to go down, okay, by Tuesday, Wednesday, Thursday, and Friday, and then pain goes up to pretty much right originally where in the first 2 days. So what should you do? Now, a lot of people would say, well, you know, it's after 3 days, so what I need to do is I need to put heat on it, right? Well, again, if you follow my chart here, if the pain is up towards the mountaintop, you want to do what? You want ice. If it goes down below towards the valley, you want to do heat. Now, where's that level? Well, we're going to say that it's somewhere in between, okay? In here somewhere. So what do we use that for a gauge to know if we should ice it or heat it? I use functionality. So if you are moving really well, you need to do heat. If your function starts to diminish and your pain has increased into this realm here, even after the 3 days, you should always be putting ice into that area. Even if, again, even if you have injured it on Monday and on Friday, the pain has been exacerbated slightly, moving up to the mountaintop. So hence, up on the mountain, you should be icing it because the mountain has cold or snow on top, right? So that's the easiest way to help everybody to try to gauge when you should heat it or when you should ice an injured area. So that's pretty much about the skinny of heat and ice. It might sound trivial, but it actually helps everybody to heal more optimally when you're doing it in a very regimented and in an orderly fashion based upon functionality and based upon the level of pain. Thanks for joining us. And of course, anytime you guys have any questions, please let us know. And please like and subscribe to our channel if you haven't already. Thank you.